Hello everyone. We all know that the doctor-patient relationship, it is the cornerstone of effective patient care. So in this video, I'll be describing some aspects of the doctor-patient relationship, and I'll show you one role play which was enacted by our medical students, and it will help us in understanding the various aspects of doctor-patient relationship.
अब कैसा है काका?
अब दर्द कम
सीने
लग
का
रहा
दर्द
है।
कैसा है?
कम है मैडम।
दवाई ववाई लेते हो?
हाँ मैडम।
खाना ठीक से खा रहे हो?
हाँ मैडम।
सिस्टर, इनका ईसीजी का रिपोर्ट का काका, हृदय की समस्या लग रही है। कल एक बार दवाई डाल के हृदय की नसों की जांच करवा लेते हैं, ठीक है? सिस्टर, इनकी एंजियोग्राम की अपॉइंटमेंट ले लीजिएगा कल की।
मैडम, मुझे एक बार अपने फैमिली डॉक्टर को दिखाना था।
देखिए काका, मैं कार्डियोलॉजिस्ट हूँ, आपकी सारी जांच बराबर हुई है, मेरे पे भरोसा रखिए। कल की एक जांच करवाना जरूरी है, उसके बाद फिर देख लेते हैं, ठीक है?
पर मैडम, मैं अपने डॉक्टर को 20 साल से दिखा रहा हूँ, मैं उनको दिखाना चाहता हूँ एक बार।
सिस्टर, अब इस पेशेंट को आप ही देख लीजिए। देखिए काका, हृदय की बीमारी है, कुछ भी होगा ना फिर वापस इधर मत आना।
So in that role play, we saw that how that doctor felt offended when the patient requested to that he will take a second opinion from his family physician. So keeping this role play in mind, let us see what is doctor-patient relationship. It is an emotional association between the doctor and the patient which arises when the doctor in a professional capacity interacts with the patient. So there is an element of interaction, and it is an emotional association between a doctor and patient. Various types of doctor-patient relationship have been described. They can be paternalistic, consumerist, and mutual relationship. So we'll see what are these types. Paternalistic relationship. In this relationship there is a high physician control and low patient control. So the doctor here is dominant and takes on the role of like a dominant parent. That is why it is called paternalistic. And patient is submissive. So this type of paternalistic relationship, it is not a good or ideal doctor-patient relationship. So here we see an example of a paternalistic type of DPR, doctor-patient relationship. Here the doctor is forcibly saying to the patient that stop smoking. So this type of advice will never be effective and the patient will not adhere to it. So this is not the ideal relationship. Then another type of relationship, it is a consumerist relationship, which is just the opposite of paternalistic relationship. Here the patients take the active role and the doctor generally are submissive or play a passive role. So for example, the doctors, they try to satisfy the patient need in terms of referral to the hospital. The patient may ask a doctor to particularly send them to refer to them to a hospital or prescribe a particular medicine or uh, give sick certificate or sick leave certificate. So here the patient is more active. So this is again not an ideal type of relationship. Then the third one is mutual participation model, and this is an optimal DPR, ideal relationship. Here there is active involvement of both parties, that is the patients as well as the doctors, and both the parties, they share the power in the responsibility, exchange of ideas, and sharing of belief systems. So here there is integration. So this is an ideal type of doctor-patient relationship. Now for effective DPR, there are three cornerstones. First is involvement of ethics in medical practice. Second is the communication skills, and third is the empathy. So these are the three important ingredients of an effective doctor-patient relationship. So we'll see what are these. Now ethics, medical ethics. There are four principles of medical ethics. The first one is autonomy. Autonomy means the patient has the right to choose his or her treatment. Now, in the role play, we saw that the principle of autonomy was not followed. The patient was willing to get a second opinion. However, the attending physician or the doctor, he felt offended. So he did not respect the autonomy of the patient. Another principle of medical ethics is beneficence. Beneficence means always do good to the patient. Then the third one is non-maleficence. That is, if you are not able to do good, at least don't harm the patient. And finally, justice. So these are the four principles of medical ethics which should be followed in the routine medical practice. Then second ingredient of a good DPR is effective communication skills of the doctors. Now many times studies have shown that the doctors do not spend sufficient time in talking to the patient. The moment the patient speak about the complaint, the doctor starts examining and prescribing the drugs. So there should be some uh, effective communication between the doctors and the patients. And some barriers of the effective communication that have been noted are the language barriers. Maybe there is some external noise or any other distractions. There is a lack of interest, or there is some disability which is preventing the interaction. The doctor and patient, they are sitting at a distance, or the doctor is annoyed by the too many questions. So these are some of the barriers to the effective communication. But again, these barriers can be overcome, and there should always be effective communication, because it is, the studies have shown that whenever there is effective communication, the compliance of the patient and the effect of the treatment is more. And finally, the third important ingredient of a good DPR is empathy. Now, empathy is the ability to understand and share the feelings of another person. So it comes from a Greek word, empathia, which means M means in and pathos means feeling. So we put ourselves, the doctor puts himself in the shoes of the patient to understand his or her suffering and feelings. So that is empathy. So a good doctor should always be empathic. And as goes the famous French saying that what is the role of a doctor? To cure sometimes, to relieve often, but to comfort always. So unless a doctor is empathic, the the patient care will not be effective. So finally, for a good doctor-patient relationship, the doctors should follow the medical ethical principles. They should develop the effective communication skills, and they should always show empathy towards patients. Thank you very much.